Ladies and gentlemen, I am happy to announce I just received my first grievance as a nurse from a female offender who I honestly don't really know what happened and why she submitted the grievance. Eventually, I'll tell you the story, and maybe some people out there who are a little more perceptive about maybe male-female interactions can give me some insight as to what maybe was going through her head. But I'm kind of like, I feel like this is a monumental milestone in my nursing career. Only because I felt like after working in psych for the majority of my career, now I'm in a prison, but after working in psych, I thought for sure maybe a grievance a month seemed kind of reasonable to me. Even if I treated the patients all really well and respectfully, just given the nature of mental illness and psychosis and all of that, I was kind of expecting to get a monthly grievance that was unfounded, but that the patient wrote against me for whatever bizarre reason, right? Up until this point, I had never actually had one of those grievances, which is kind of surprising for me. I remember working with some staff that were overtly disrespectful to patients, and they would get grievances all the time. It made sense. And then you'd get the grievance, and a lot of times because patients are kind of a little incoherent and disoriented, you'd read the grievance. I'm like, that doesn't really make sense, but I kind of understand where they're going with what they wrote in their grievance. But I guess maybe at this point in the video, I should kind of explain what a grievance is, and then I'll tell you guys the story. So a grievance, they're actually really important. I'm glad we have them. So when I worked at the state hospital, if a patient wanted to file a grievance, they would come to staff and they say, hey, I need a grievance form. We would give them a grievance form. They would fill it out. And then whoever the grievance was against, let's say that it was against me as the staff member, they would hand that grievance to me. I would read over the grievance, find out what their kind of main objection was or what they wanted changed. I'd go back, we approach the patient, we would talk about it, we'd flip it over, we'd come up with a resolution, we'd write out the resolution, and then we both sign it. That's like your ideal situation. More often than not, it rarely happened with that. Usually most staff that I saw who did receive a grievance weren't able to resolve it with that patient, or that patient wasn't even interested in resolving it with that staff member because there was just so much conflict between both parties. So that's kind of what a grievance is. And then typically what you do is after you get the grievance, you give a copy of that grievance to the patient once you guys have signed it. And then the other copy, we would send it to patient advocacy. And then if the grievance didn't get resolved, it would kind of go up the chain of command. And then that's pretty much more or less what a grievance is. All right, so let me share with you the story about this female offender that submitted the grievance against me. She came in to our facility as a new intake. The facility that I'm working at, it's an all-female prison. It's I would say low to medium security prison. I mean, we got like fences with barbed wire, all the doors are locked, steel doors, etc. And she came from, I want to say, some sort of local county jail. So my very first interaction with her was at the med window. So we've got this long, big old plexiglass med window. The offenders come up. We've got this little steel door that flips open. We scan their ID card and we give them meds. So she hands me her ID card. I scan her ID card. I'm like, hey, Rebecca, not her real name, of course. I'm like, Rebecca, I actually don't see any medications on your medication administration record. So I scan her ID. I look at the computer. There are no meds listed for this gal. She gets a little frustrated with me, gets a little short with me, saying that she should be on X, Y, and Z medication. And she's mostly concerned about her Keppra medication, her anti-seizure medication, because she should be getting a rather large dose tonight. She gets it twice daily. And she's like, where are all my medications? She mentioned a bunch of psychotropic medications. I'm like, well, that's bizarre. Like, I literally see nothing. I know you're a new intake, but I don't have any medications in here. So I write down her name and her DOC number, and I tell her that I'll do some investigating later. But basically, when she was at the med window, like, she was pretty disrespectful to me. Other staff that I work with there, not all of them, but some of them just would have been like, get away from my window. I don't want to talk to you, based on the way that she was behaving. But I was like, you know what? I'm going to give it the benefit of the doubt. Whatever. It doesn't bother me that much. I'm used to working with psychotic patients. Like, I can handle this lady, right? So I tell her I'll do a little investigating. So after Medline's over, I pull her up on our system. I go through all of her documents. I eventually find paper MARs that were scanned into her system. I print them out. I'm trying to like understand them, because if you've ever looked at a paper MAR before from another facility, they can be rather confusing. And there was just like all this ink on them. And I'm like, bro, is she supposed to be taking these medications? So I eventually find this like whole med list for her on the paper mar, it looks like she's been taking X, Y, and Z medication, including Keppra and a bunch of other psychotropic medications. Then I go through her file and I'm just like looking for various diagnoses to kind of support that she should be taking these medications, etc. And once I get enough information, I'm like, okay, I'm pretty damn sure these are the meds that she should be taking. These are the meds that she told me she was taking. They coincide with this list over here. I'm pretty confident she should be taking these meds. So I go back and I review some provider notes, things like that. And essentially what I think happened is the provider simply just forgot to put in all the medications that she should have been taking, right? So of course this whole ordeal happened at nighttime. We didn't have our provider on site. So I called our on-call and I shared with him all the information that I found when I looked through her chart and when I looked through her MAR. So I was like, hey, look, can I get a one-time order for all of these meds? And then I'll put all this information on our provider's desk for tomorrow for review, and then she can decide whether or not she wants to continue the medications. He's like, yeah, that's totally cool. So I eventually go above and beyond. Like, I honestly didn't have to do any of this for the offender. I just felt like it was in her best interest, obviously, to take her meds, assuming that she was supposed to take them. And so that's why I did it, despite her just giving me a bunch of attitude at the med window. So anyhow, I eventually call her up. I'm like, hey, you can come up here. We got your meds ready. She was appreciative. She thanked me. She gets all her meds. No issues, no harm, no foul. Our provider eventually looks over the paperwork and she continues all the meds. And I think that's just what happened. Somehow her meds got dropped off when she transferred facilities and they weren't on her medication list. So not a huge deal by any means, right? So a few months pass by. I don't really interact with this offender whatsoever. Well, last week she comes up for an anatomical. And anatomicals are when offenders will either strip down to their bra and underwear or they'll be completely naked depending on the circumstance. And then we as nurses just have them spin really quickly. We assess them for injuries, and then we mark it on a sheet. We scan it into their file. So she comes up after hours, of course. Everything always happens after hours. She comes up for an anatomical. An officer escorts her up to our medical facility. And I'm working with a female coworker, and generally what she and I do is, like, if we have an anatomical, she will do the anatomical because I just feel like it's a general courtesy for female offenders to be viewed by a female and not by a male. I just feel like most females are more comfortable with that, so that's generally what we do. So the officer escorts her up. He comes back. They both enter through a secure door into our clinic. And then in our clinic, we walk down a little hallway and we take her into an exam room and the door is left open. The officer stands outside the door and then she and my female coworker go in there. And my female coworker's about to perform the anatomical. She pulls a curtain like this so nobody can see. I head back to the nurse's station and then I hear my name. She's like, hey, Nick, can you come back? She's like, hey, I'm pretty sure that we have to have 2 staff in here during an anatomical. And I can't remember. Maybe that's the policy, but I'm like, all right, that's cool. So I come back in there. She's fully clothed and she's like, wait, do I have to get naked for this? I'm like, no, for this anatomical, you just have to be in your bra and underwear. I was like, you got your bra and underwear on, right? She's like, yeah, I do. And I was like, that's cool. She's like, okay, well, that's good because I'm definitely not going to be stripping in front of no male. And I'm like, that's cool. So because she said that, I'm thinking, okay, she wants a little privacy. She's probably not comfortable with me being in here, even though I have to be in there. My female coworker is going to do the anatomical. So I am just like standing in the room and I'm like, she strips down and I just kind of avert my glance. Like, I don't want her to think that I'm looking at her, but still I'm there probably for safety and things like that. Nothing really exciting happened during the anatomical. All I know, she took her clothes off. My female coworker quickly assessed her for injuries, looked at her hand for injuries. She didn't have any injuries. She put her clothes back on. We opened up the curtain and that was it. Like a routine, normal anatomical, nothing out of the ordinary. There's nothing bizarre at all that happened during the anatomical. The male officer was standing out there. So yeah, like in retrospect, there's nothing bizarre whatsoever that happened with this anatomical. It's very similar to other anatomicals that I've participated in. She didn't have any injuries. It was relatively quick. She was in and then out. Well, then a week later, one of my coworkers was like, hey, Nick, did you see that you got a grievance from so-and-so? And I'm like, what? A grievance from Rebecca for what? And I was like, are you talking about the lady that we did the anatomical on? And they were like, yeah. I was like, I'm just like, I'm so flabbergasted. I don't even know what to say. Then I picked up the grievance just to see kind of what it said. And it just said that she's filing a PREA complaint against medical staff. So it wasn't particularly my name, but I don't even think she knows my name. And there was 2 of us in there. And so maybe the grievance is against both of us. I really have no idea, but all it said was that she wanted to file a PREA complaint against us. And PREA stands for Prison Rape Elimination Act. And I'm like, so I really have no idea what went on. It's just a little frustrating for me because I feel like this is one of those offenders who I really did go above and beyond for. And then later she like nips us in the butt with this unfounded grievance for who knows what reason. And I'm not sweating it 2 cents. There was nothing that I did wrong. Anatomicals are part of our duty as a nurse. In fact, if the female nurse was not there, it would have been me performing the anatomical, and that happens all the time, or it's a male performing the anatomical. I guess if it were me in that situation and it was a male officer that brought her up, I would have just had another female officer present inside the room while I'm doing the anatomical. I mean, other than that, though, that's pretty much the experience. I don't think anything bad is going to come of it whatsoever. They probably will do some sort of investigation, but I don't think there's really anything to investigate. There were 2 other witnesses there. Nothing happened, so I'm not worried whatsoever. And grievances, I guess I'll kind of end the video on this. Like, unfortunately, in my experience, at least when I was working in mental health, grievances really don't get the attention that they deserve. And I get it. There are going to be a number of unfounded grievances, especially when working in a psychiatric setting, that just completely make no sense. At the same time, I can tell you a number of coworkers that I had who routinely disrespected patients in the form of just being short with them or just kind of verbal abuse, not calling them names or anything like that, but just kind of in their tone, disrespectful, condescending tone, things like that. And these staff would routinely have grievances filed against them, and nothing would ever come of it. And personally, like, if I was in charge of a hospital, like, I get it. I would imagine that at one point in their career, everyone who works in psych should probably have a few grievances against them. But when there is a historical pattern of grievances against a particular staff member from separate patients, and the grievances are similar in nature, you would think that would be enough for us to be like, we need to help this staff member out. Maybe they need a little additional training in tact or something like that, or just how to be more polite with patients. And in my experience, like, that was never done. It's kind of like this thing that I feel like the hospital did to cover its own ass and to make it look like they were giving a damn. That's really what I think it was. Even like our patient advocacy people, wonderful people, but I just don't ever feel like anything really ever came about from the grievance. And honestly, as a nurse, I really like grievances because I would rather have a patient sitting down there frustratingly writing on a grievance and putting all their energy and thoughts into that grievance rather than them getting like pissed at staff or their peers or wanting to assault someone. So I feel like it's very therapeutic for the patient. Plus, if you're the patient, you kind of feel stuck on that unit. You are stuck on that unit. It was a locked facility. Like, they can't go anywhere. And if staff is mistreating them, like, who else do they go to? And unfortunately, there were a few units where I felt like the majority of staff were just straight up dicks to the patients, and their grievances yet were not being taken seriously. So it's like, at that point, what do you do? If I were in charge of the grievances, I would just look for patterns. And if separate patients who come from separate institutions, who do not affiliate with one another, but are all submitting a similar grievance on that same staff member, you would think that would be enough where the hospital would focus on that staff member and be like, hey, we need to figure out what's going on and what we need to do to improve the situation. Anyhow, that's my story on the grievance. If any of you know what was happening with the female or why she may have submitted the grievance, please let me know. Really, the only thing I thought was like, maybe she's just super uncomfortable with having a male in there. And like, I totally get it. And sometimes I think these anatomicals might be a little punitive in nature because the females have to strip down. And I feel like when they get into these fights, oftentimes there's no bruises whatsoever. The majority of my anatomicals, probably 70% of them, come back with no injuries, in which case I'm like, why are we having them strip down? And this one gal I remember in particular, this is a weird anatomical. This is like a month ago. She had to strip down naked. She was in chains, like shackles. And I was taken aback because every other anatomical I had done up until that point, they had been in bras and underwear. All of a sudden, I open up the curtain. There's 4 officers there. She's completely butt naked. And I'm like, sweet mother. She's tearful. She's crying. And yeah, so it seems a little punitive to me. I guess I'll just end the video on that. All right, bye.